pushed me back awake. Hola! So my name is Valerie Okore. I'm a fourth-year medical student studying at Ebonyi State University, Nigeria. And I make videos that help students, youth, and new graduates to earn and learn online. And today I'm going to be sharing a study with me video about me reading an awesome book in medicine called Clinical Diagnosis in the Tropics. Yeah, this book is really amazing because it actually teaches you about different clinical scenarios that happen to people living in the tropics. Now, most medical books are written for those in like high rising areas, first world countries, and not really for people that live in the tropics. And most diseases are actually found in the tropics. And the diseases found in the tropics are based on bad things, are based on poor living conditions, poor water supply, and poor nutrition, right? And now in places like first world countries, the diseases, they are based on modifications, new living changes, different kind of cancers, based on different kind of new foods. They are eating genetically engineered things, exposure to radiations, right? So this book is really amazing for new medical students that are just starting their clinicals to really see diseases that affect people living in the tropics. That's why I'm going to be doing a full study with me video on this textbook. We're going to finish this textbook. At the end, we're going to summarize this textbook. Actually, this textbook has about 10 chapters, so I'm also going to show you each chapter. At the end of each chapter, we're going to do a summary. And if that sounds like something that you are interested in, please subscribe to this channel. Let's get to know more about medicine and the clinical diagnosis. Also, I also make videos about how you can learn and earn online. So if you want more money videos, check up above, and also in the description. You're going to learn how you can make money as a student. So with no further ado, let's get into the study session. So just have to like stretch a little bit, right? Okay. Yeah, I also have this school highlighter set. I really love it because the casing is really cute. It's strong enough to hold my casing, so I do not need to throw away the pack. Anyway, they're really cool. They come in yellow, green, orange, and pink. So more sets and stationery is coming up for you. Wow. Wow. Okay, first of all, let me drink some water. So, I actually just finished chapter 1 of this book. And I must say, it was quite amazing. Like, it was beautiful. They talked about, first of all, how clinical medicine, right, in the tropics is very different from where it is in first world countries, as I said earlier. They also talked about pigmented skin, that is women and men of color, right, people of color, and how there are different diseases that cannot easily be spotted in a pigmented skin. Now, like rose spots found with typhoid fever, right? Now, they can be spotted in someone of a white skin, but can't really be spotted in someone that has a pigmented skin in a typhoid disease, right? And that is very important. And most textbooks written for medical students are written by people in the first world countries, and they don't really spot the fact that people with pigmented skin have different approaches to these diseases. Like, okay, you can also spot swelling of lymph nodes with someone that has been walking barefoot, and also because of this walking barefoot, you cannot also spot the Babinski sign. I'm going to tell you about the Babinski sign in a later video. Now, as you can see, this textbook is really, really important because it teaches every medical student to forget not just about all the equipment, the gadgets that has been brought to make medical practice very easy in our 21st century, which is quite amazing. Now, it also tells you that you really have to understand clinical history taking and clinical examinations as a new medical student. Yes, over time you will adapt to the technologies that have been brought to make things easier for you as a medical student, but as you're entering into the world, you have to know that there are some places that haven't yet had this medical equipment, and you will know that there are patients that also cannot afford the facilities that this equipment require. And because of this, they would rather not come to the hospital. They would rather stay or go to a traditional or spiritual healer for attention and for care. And most times, any patient who goes to a traditional healer for treatment will always end up worse. And because medicine is about caring for man, we have to realize these things and really fully focus on taking a good clinical history and also an awesome clinical examination, because this will lead to good judgment. Now, another issue this book also talked about is when you are facing language barriers. Now, having a good lingua franca of what is being said or communicated by your patient is really amazing. Now, in tropical areas or countries, you really don't find this because rather than the common language that is being spoken of, like English, French, Arabic in all over the world, it's hardly spoken in tropical areas. They have more of traditional languages, right? So as a medical student who just recently entered into the world, you find it hard to really communicate with these people, with this language that they speak. Like me, I'm from Nigeria and I speak Igbo language, right? Kedu. Okay, but I also really speak English. Why? Because I am educated and I learned this in school, obviously. But many people are not like this. And if I want to go and treat them in their areas, or even in my school, like lots of patients don't speak English, and it's quite difficult because for you to actually treat them or clerk them effectively, you have to speak in their language or have an interpreter. And when you have an interpreter as a medical student clerking a new patient, you find it difficult to communicate. So this book is awesome because it's going to show you how you can actually clerk a patient who is not, in your niche, like a patient that is quite different, a patient that is of color, a patient that lives in the tropics, a patient that is actually, not in the high and rich area, that is not among the elite, a patient who is in the masses, because that's what we're all about. We're all about caring for people, no matter where they are, rich or poor, right? Tall or short, fair or dark, white or black, red or yellow. You know, that is what being a doctor is all about. And I don't think there should be any form of race in medicine. So if you are part of this movement, I really want you to be able to study this book. Now, since we're done with chapter 1, tell us about what this book is about. We're just going to simply dive into chapter 2 because I feel that's very important. So chapter 2 will also be quite as you know easy, but wait, okay. So since we're done with chapter 1, we're going to dive straight into chapter 2 because chapter 1 was quite small, just telling you what clinical diagnosis in tropics is all about and why they are going to be teaching you. So if you haven't gotten this book, please get it. Clinical diagnosis in the tropics. We're going to be reading it together all throughout this playlist. So let's move to chapter 2. Yeah, actually, chapter 2 is called An Approach to History Taking. Yeah, so you know what history taking is as a medical student? You know, history taking is simply when you are cracking your patient, asking them things about them so that you can really understand why they came to the hospital. So let's get into it. At the end of this chapter, I'm going to give you a brief summary. Okay, guess what? Because I'm actually not using any Pomodoro technique. I'm just getting right on to study. I put a timer to study for 1 hour because I feel like Pomodoro kind of gets you out of the zone. Yeah, I know in other videos I talk about how Pomodoro is awesome for you, but as a medical student that wants to study for long hours, I would advise like trying to make your Pomodoro sessions like maybe 1 hour or 15 minutes longer so that you can be able to study for a longer period, right? But the disadvantage of this is that going to start feeling sleepy. Like, I'm not saying all this are easy and just reading a story, but it's quite interesting actually. It is, but we're humans. Our brain does not like stress. And like me, now I'm feeling sleepy. But because I have you by my side, I will keep pushing because we're almost done with chapter 2. And at the end of chapter 2, we will try diving into chapter 3. And if we're able to do that, oh man, we are close to the end, right? Okay, so let me continue because you've kind of pushed me. Oh yeah, if you like this like intermittent talking within the video, please also tell me in the comment section. If you do not like it, you just want to be quiet or true, also tell me in the comment section. Thank you. Wow. So I was actually feeling chill. So I decided to go and off the AC. Ooh. But the good news is, according to my book, they said that, viruses, whatever, that most of those diseases or disease-causing organisms, they like warm environment and cold environment. So since here it's cold, that's great. Except the coronavirus, who likes cold. I don't know who sent that virus, but anyway, let's be learning so we can crack this thing well. Did I honestly just put my head down? Oh, that's life. and we are done with chapter 2. So, as I said, chapter 2 is an approach to history taking, and this was very, very detailed on, first of all, the kind of patient you are going to be having a history taking on, and they went ahead to actually talk about, first of all, you clock in the patient which is taking the clinical history. So let's go ahead and really see what they talked about in this. First of all, they told you about how you can approach the patient. You have to say your name. You have to treat the patient like, well, you have to say your name. You have to treat the patient what I like to call IPGU. That's first, you have to be, what's the I again? That's this. Sorry. I know it's patience and understanding. Be patient, be gentle. Okay. Sorry. So first of all, they went ahead to talk about how you should approach your patient, right? You have to be patient, you have to be gentle, you have to be understanding, because a patient in the tropics finds it strange, right, in a hospital environment, because they would rather go to maybe a traditional healer or a spiritual healer. And now when a patient tries, attempt to really go to a hospital to get appropriate treatment, you now have to really take care of that patient. Now, the first thing you have to do is introduce yourself. Tell the patient your name. Now, you have to try your best to make the patient as comfortable and confident in you as possible. That means you have to keep reassuring the patient that he's okay, that that he's in good hands, right? That you're going to take good care of him. Try making sure that you have reassured that patient to the state or the point where he's comfortable with you. Now, once you have achieved that rapport with your patient, you now move to the full history taking by first starting with the biodata, which are asking about his name, his age, his sex, right? And some other simple details like religion, occupation, education, and all that. Now, after you've taken the biodata, next thing you move into is the full complaint. That is what exactly the patient come for. Now, once you've gotten the full complaint, you really have to dive deeper. Now, you have to think about the mode of the onset, right, of the complaint, and how it has. Now, once you get the full complaint of the patient, you have to think about 3 things, so you can really dive deeper into it. You have to think about the mode of the complaint, right? You have to, Now, once you've actually considered once you found about the main complaint of the patient, you have to think about these 3 things. I'm going to actually look down here, right? Now, think about the mode. You have to think about the mode of onset of the complaint. Now, this might be quite difficult because most patients in the tropics don't really know the different dates and time. They usually relate it to different disasters that's happened, or maybe market days and stuff like that. Now, after the mode and time or the mode of onset of the disease or the complaint, think about how it has developed over time and how it has, varied, right? Maybe something like headache now, maybe it started like a week long of headache. Possibly when it started, it was just mild, right? Now, a week later, it is throbbing, like it is now more painful, like it's discomforting. So you're seeing how it has progressed. Now, the next thing you have to now see how the pain is aggravating or relieving. What are the factors that aggravate the pain or the complaint? What are the factors that relieve the complaint? Now, example, a patient that is having lots of palpitations, right? Maybe when he's at rest, it is it is prolonged. Now, palpitation is where you feel your heart beats. When it's at rest, it's less. Now, when he runs, it's more. So those are aggravating, that is things that makes it worse, and relieving factors, things that makes it less. All right, now next you go into the systemic, systemic question. You start asking questions about each system. This is very important because after you found out about the main complaints, you have to actually check out each system to see if there's any underlying complaint that the patient may not have complained about, but it's part of the reason that is causing his illness. Like I talk about the nervous system, the GI tract, the cardiovascular system, the endocrine system, and many other systems. Once you really checked each system, you're able to understand if any of those systems are actually causing the problem. Now, next is for you to talk about the past medical history of this patient. Has the patient been to another hospital before? Has he seen a traditional healer before or spiritual healer? Has he taken, whatever the patient has done medically before seeing you? Next, you have to talk about the family history. What is the family history of this patient? Think about his father, his mother, are they dead? Is any of them dead, and why did they die, right? Think about his relations, his siblings, how old are they? What's still the same thing, did any of them die, and what caused them to die? Sorry, any of them were diseased. Sorry for saying the word die just like that. Okay, also think about these things, their whole family, is there any history of deaths due to a particular disease? Now, because during the Ebola virus or during the Lassa fever, which is more common here in my country, lots of families, they usually passed it around from father to daughter and all that. And when a patient will come, they will keep asking them, like, are any of your relatives dead? What killed them? Because they want to know whether it is Lassa fever that's affecting them, right? Now, next you're going to find out is the social history. Now, social history will involve how many sexual partners do they have? Do they smoke? Do they drink? Right? These are very important because these are things that they do within their environment and will also affect their health. And you can also use this to really understand if they are going to be susceptible to a drug or not susceptible to that drug. Like, for instance, someone who takes alcohol will not be able to really take a little amount of anesthetic drugs, will take more because his body will metabolize those anesthetics faster. So this is very important when a patient is about to undergo surgery. Now, next you're going to take is the past medical history. Past medical history too, I've already said that before. Next is past drug history or therapy. What has that patient taken in the past? Was there any past medication, potions, drugs, herbs the patient has been taking? Because when you talk about kidney or liver problems, it's really based on what the patient has taken over time. Here in Nigeria, in my clinical hospital, lots of patients usually have lots of kidney and liver issues. Why? Because they take a lot of herbal medications in excess over time, and this leads them to coming with presentations of AKI, that's acute kidney injury, or nephrotic syndrome. This is quite disheartening. So it's very important to know about their past, drug history. Now, also their present drug history. What are they taking right now? You see, some of them have taken some over-the-counter drugs before coming. So everybody also know what they are taking now so that you can actually understand why they are in the state they are in. Now, next is allergies. This is very important because some patients suffer or are allergic to different drugs, right? And now when you give a patient a drug without knowing their allergy, this will lead to fatal and also very, very bad conditions. So ask the patient, are you allergic to any drug? Okay, are you even allergic to dust? Are you asthmatic? Because asthmatic patients really, dust can cause them to enter into an asthmatic attack. So these are the things you require in taking a good history. Next for you to do is your summary. Take a summary of it all so that you can be able to present this. Now, it's very important as a new medical or clinical student to be able to keep practicing. Definitely, clinical history taking will get better over time. So keep practicing. Practice with your professor. Also practice with your mates. Practice with your friends. Start creating OSCEs for yourself. Objective structured clinical exam. Start trying to do this. Make your friends act like they are sick. Clap them. When your friends are actually sick, clack them, because over time this is going to become like a second nature for you. And yes, how long will a clinical history taking take? Take about half an hour, that is 30 minutes. But over time, it can become less. So keep practicing, keep learning, and this is going to be a piece of cake for you very soon. Now we are done with chapter 2, and I've summarized that. Chapter 3 is about outline of physical examination. Talk about history taking, now is physical examination. But I think this is enough information for you today. So thank you so much for watching this video. I was super excited to talk about this, and we've done 2 chapters in this textbook, which is Clinical Diagnosis in the Tropics. Very, very wonderful book if you want to study about, people of color or people living in the tropics. You want to really understand the differences that they have, what makes them special. And this book has no biases. This book is talking purely about people in the tropics, and it's going to help medical students to fully understand how they can clap despite the different technologies that have come to make things easier. Right? So thank you so much for watching this video. If you really love this video, give the video a thumbs up so others can see this video like yourself. And I'm Valerie Okori. I'm a fourth-year medical student. So if you want to hear more from me, and if you really want to get to see about this book and the playlist I'm making, please also subscribe to this channel. Leave a comment in the comment section if you have any questions about this book or what I've said about clinical history taking and introduction to this textbook. Right? And I also put this question to you. Are you a medical student? If yes, tell me in the comment section. Have you started clacking? If yes, tell me in the comment section. And also, do you find clacking difficult? If yes, also tell me in the comment section. Thank you so much for watching this video, and I'll see you in the next one.